So that's why very important for us to determine at the first level the level of the health literacy that they have. So it is very important for you to understand the level of the health literacy. Don't forget to assess the cognition and the support that are available. Once you know that, try to make them understand about their disease. And important when the doctors or prescriber change their medication, and once they convince enough, then only they will adhere with your treatment plan. So once you're done with that part, you should not forget about performing medication review. Basically, medication review is just reviewing the medication list. Okay? Sounds simple, but when you deal with elderly with multiple comorbidities, it takes time. It needs skills and it needs patience, and you need to have the communication skill to do this process of medication review. So how do we educating among our pharmacist team or among our healthcare provider? It's very important, number one, to identify whether the patient had a polypharmacy or not. Because polypharmacy always creates a, not most of the time, a negative event if it's inappropriately managed or poorly managed. Once you identify, you need to ensure everything is appropriate. Sometimes you just can't avoid of giving medication more than 5. So then, proceed with try your best to simplify the regime, but do not stop there. You need to help the elderly or the caregiver to understand about their medicine in terms of aiding their adherence process. Because polypharmacy is always a cycle of process of giving treatment plan to a patient. For example, as I already mentioned earlier, when you're dealing with multiple comorbidities patients, they often end up with multiple follow-up. And when you fail to reconcile the medication as part of the medication review process, you always end up with polypharmacy, whereby you might know or you might not know, and this end up with drug-drug interaction, which subsequently lead to adverse drug reaction. And most of the time, 50% of them won't adhere to the polypharmacy, which the doctor might thought is a failure of treatment, or the symptom is a new disease, and it will lead to a prescribing cascade, and sometimes treatment fail, and the cycle keep on going if you don't reconcile at the beginning of the process.